you've got pain on the inside part of your knee and you're trying to figure out what exactly could be causing that, then I'm going to let you know what your 3 options are. And there really are only 3 main options that cause pain on the inside part of the knee. I'm Dr. Brad Homan, board certified orthopedic surgeon. So I'm going to start by kind of just showing a little anatomy with my plastic knee over here. So the inside part of the knee, or what we call medial, has 3 main structures that can cause discomfort. The first one is what we call the medial collateral ligament, or the MCL. So the MCL is a thick band of tissue that connects the femur to the tibia bone, and basically its function is to keep your knee from going too far this direction. The second structure that could be potentially causing kneecap pain in the middle of your knee is what we call the medial meniscus. So this is like a rubbery cushion on the inside part of the knee. As you can see, it kind of goes along the outside or the periphery of the joint, but it's right along the inside part of the knee underneath the medial collateral ligament. And the third structure is going to be the cartilage. And so if you've got arthritis or damaged cartilage of the cartilage that's on the bone on the inside part of the knee, then that will also potentially cause pain on the inside. So if you like this content, like and subscribe and share with your friends. I'm going to go into some detail on each one of these so you can figure out which one of these things could be potentially causing your medial sided knee pain. So the first one is the medial collateral ligament. If you sprain that ligament, that can cause pain on the inside part of the knee. And most of the time, it's going to take a trauma to cause damage to the MCL. And there are 3 kinds of medial collateral ligament sprains. One would be what we call a grade 1, which is just kind of a pull of the ligament. So that's not going to have a pop or result in any swelling, but it's just a little bit of a pull, and you're going to feel that for a few weeks on the inside part of the knee. Grade 2s and 3s are when the ligament is actually torn to a certain degree. A grade 2 is when the ligament is partially torn, and a grade 3 is when the whole thing completely ruptures. With those injuries, you will get swelling only on the inside part of your knee. So instead of the entire knee blowing up with fluid, which would indicate something in the joint is happening, you're only going to get the swelling on the inside part of the knee around the ligament. And that swelling could also be associated with bruising. If it's a grade 3 sprain, you will notice that your knee feels a little bit unstable. And in that case, you need to get a brace that has hinges on the side. So MCL sprains, usually from a trauma. The grade of the sprain depends on how long you're going to have symptoms and whether or not you may or may not need a brace that has hinges on the side for support. So that's the number 1 cause of pain on the inside part of the knee. So number 2 for the meniscus. The meniscus is inside the joint, and usually to tear a meniscus, it requires a bend of the knee with some kind of a twist. Not always, especially as you get a little bit older, the meniscus can tear with a minimal trauma, but usually it's a bend with a twist. And if you have a meniscus tear, when it happens, you might actually get swelling in the joint. So the whole joint may swell up a little bit. Not a lot, but a little bit. And you may actually get recurrent swelling if the tear is big. So usually you feel pain from a meniscus tear with deep knee bending, side-to-side motions, or twisting. And those are the motions that will aggravate that meniscus and create persistent symptoms. Most of the time, if the meniscus tear is small, it may potentially heal up okay. But if it's a large meniscus tear, they do not heal very well, and you may just get persistent symptoms in your knee for an extended period of time. So if you've got pain on the inside part of the knee associated potentially with popping or swelling, and it's going on for 1-2 months, then you might want to get that checked out and make sure it's not a meniscus tear. So the third cause is arthritis, and that's where the cartilage on the ends of the bone is diseased and starts to wear off. And when that happens, it also causes pain on the inside part of the knee if that's where the arthritis is located, and medial arthritis is pretty common. So your symptoms from that are actually going to be very similar to a meniscus tear in that you can get swelling in the knee joint. Certain movements like bending and twisting of the knee are going to aggravate that kind of pain, and it's not necessarily going to get better over time. So if you get swelling, locking, catching, it could be arthritis, could be a meniscus tear. You start with the regular treatments, which are going to include some activity modification, ice to get the swelling down, potentially medications to help with the inflammation, bracing to give support. And if those measures are not effective, then you want to see your healthcare professional, get some x-rays, get some imaging, and get the diagnosis cornered, because arthritis and meniscus tears, if they're large, are going to require some further treatment outside of just the regular medications, bracing, and ice. So those are going to be your 3 main causes cause of pain on the inside part of the knee. I hope you found this useful. If so, please like and subscribe to the channel. I'm Dr. Brad Homan, board certified orthopedic surgeon, and my message is always take care of your knees and they will take care of you.